Kidney failure prevention. 5 early signs you shouldn't ignore. Do you know that your kidneys can lose nearly 80% of their function before showing any obvious symptoms? That's what makes kidney disease so dangerous. It develops silently, often without pain or warning, until the damage becomes severe. Most people never realize their kidneys are struggling because the early signs are easy to overlook or mistake for something else. The truth is, your kidneys are working every second to filter your blood, balance electrolytes, and remove waste. But when they start to fail, your body begins sending subtle distress signals, quiet messages that something isn't right. Recognizing these signs early can make the difference between recovery and long-term damage. Today, we'll uncover 5 early warning signs of kidney failure that you should never ignore. Each one is a chance to act before it's too late to protect your kidneys, preserve your energy, and safeguard your overall health naturally. Let's begin with one of the most common, but most ignored early signs: persistent fatigue and low energy. Your kidneys are not just filters. They are also vital regulators of oxygen delivery throughout your body. When kidney function begins to decline, toxins and metabolic waste start to build up in the bloodstream. This toxic overload makes your blood thicker and heavier, forcing your heart and other organs to work harder. The result? You feel tired even after sleeping well, and that exhaustion doesn't seem to go away no matter how much rest you get. Fatigue caused by kidney problems is different from ordinary tiredness. It's a deep, heavy sense of weariness that affects both your body and mind. You may feel physically drained, mentally foggy, and emotionally low. Many people mistake this for stress, age, or lack of sleep, but it's actually your body's way of signaling that your blood isn't being cleaned properly. The longer this continues, the more toxins accumulate and the more exhausted you become. Healthy kidneys also help produce a hormone called erythropoietin (EPO). This hormone signals your bone marrow to create new red blood cells. But when the kidneys start to weaken, they produce less EPO, leading to anemia, a shortage of red blood cells. Without enough of them, your body can't carry oxygen efficiently to your tissues and brain. That's why kidney-related fatigue often comes with dizziness, shortness of breath, or pale skin. In the early stages of kidney damage, this fatigue may appear intermittently, maybe in the afternoon slump or after light physical activity, but as the kidneys continue to lose efficiency, it becomes constant. You might find it difficult to concentrate, to stay awake during the day, or to perform tasks that once felt effortless. It's not laziness, it's biology. Your body is literally running low on clean, oxygen-rich blood. Some patients describe it as a heavy fog settling over the day. You wake up tired, drag yourself through routine tasks, and crave naps even after full nights of sleep. Coffee doesn't help much, and even minor physical effort feels like climbing a hill. If this sounds familiar, it's worth considering that your kidneys might be working harder than they should, struggling to clear waste from your system. Another important detail is that kidney-related fatigue often coexists with other mild symptoms like headaches, poor appetite, or mild nausea. These occur because excess urea and creatinine circulating in your blood can affect your digestive system and nervous system too. Your body's internal balance or homeostasis is quietly disturbed, creating a ripple effect that touches every cell in your body. Doctors often suggest checking for anemia, creatinine levels, and GFR, glomerular filtration rate, when chronic tiredness has no clear explanation. Early detection can prevent long-term damage. Once your kidneys are supported with proper diet, hydration, and medical care, fatigue often begins to fade, a clear sign that your body is regaining balance and energy. To naturally fight kidney-related fatigue, focus on foods that boost red blood cell production, like spinach, apples, pomegranates, and iron-rich lentils. Avoid excessive salt and processed foods that burden your kidneys further. Hydration, light walking, and breathing exercises also enhance oxygen delivery and improve blood flow, giving your kidneys the relief they need to restore your energy levels. Finally, remember that fatigue is not a sign of weakness. It's a sign of communication. Your body is trying to tell you that something deeper needs care. Instead of masking the tiredness with caffeine or painkillers, listen to it. Take it as a cue to check your kidney health, because catching the issue early could prevent years of silent damage and preserve your vitality for the long run. If you like this kind of kidney healing content, type 0 in the comments. And if you don't, type 1. I create these videos for your better kidney health, to help you understand your body, prevent damage early, and heal naturally through awareness and small daily choices. Your feedback helps me make each video more useful and personal for you, so don't forget to comment below and let me know what you'd like to learn next. The second warning sign your kidneys may be struggling quietly is unexplained swelling, especially in your ankles, feet, or face. Your kidneys act like filters that maintain fluid and salt balance. When they're healthy, they remove extra sodium and water through urine, keeping your body light and stable. But when these filters begin to weaken, excess fluid starts leaking into tissues instead of being expelled. This buildup leads to noticeable puffiness in areas where gravity pulls fluid down, usually around your ankles, feet, or lower legs. In the morning, swelling may appear under your eyes or across your face. This happens because fluid redistributes while you sleep, accumulating in softer tissues. Many people wake up with puffy eyes or a bloated appearance and assume it's due to poor sleep or too much salt, but in reality, it can be an early sign that the kidneys are not maintaining proper fluid balance. Unlike normal swelling from injury or heat, kidney-related edema feels soft and pits easily when you press your finger into it. This is called pitting edema. The mark stays for a few seconds before the skin returns to normal. It may not hurt, but it's a silent signal that waste and sodium are accumulating beneath the surface. You might also notice that your shoes or rings feel tighter, or your socks leave deeper marks on your skin by evening. In severe cases, swelling can move upward, reaching your calves, knees, or even your hands. The more fluid the body retains, the harder it becomes for the heart to pump effectively, which can worsen both kidney and cardiovascular strain. Swelling doesn't happen in isolation. It often comes with other subtle signs like shortness of breath, weight gain, or reduced urine output. This combination indicates that your body is retaining more fluid than it's releasing. Ignoring these early warnings can allow kidney stress to progress silently toward chronic kidney disease or hypertension-related damage. If you notice recurring swelling that doesn't improve with rest or dietary changes, it's time to act. A simple blood and urine test can measure your creatinine, GFR, and sodium balance, all of which help identify early kidney impairment. Early action can prevent further fluid buildup and protect your kidneys from long-term decline. To manage swelling naturally, reduce sodium intake by avoiding processed snacks, pickles, and restaurant foods. Replace them with fresh, home-cooked meals rich in potassium-balanced vegetables like bottle gourd, cabbage, and cucumber. These foods help flush out excess water without overloading your kidneys. Drinking clean water in small, steady amounts throughout the day also supports gentle detoxification. Modern kidney experts often recommend gentle herbs such as punarnava or parsley water to aid natural diuresis, meaning they help your body release trapped fluid safely. Light physical activity, like walking or gentle stretching, also helps improve circulation and prevent further water retention in your legs and feet. Most importantly, don't treat swelling as just a cosmetic issue. It's your body's way of signaling internal imbalance. The earlier you respond with testing, hydration, and lifestyle correction, the better chance you have to stop the progression of kidney strain before it becomes permanent damage. Awareness and early intervention truly make the difference between prevention and dialysis. The third early sign that your kidneys may be in trouble often shows up in the most obvious place: your urine pattern. Your urine isn't just waste. It's your body's report card on how well your kidneys are doing their job. Every time you visit the washroom, your kidneys are communicating something through the color, volume, or texture of your urine. When these filters begin to fail, one of the first noticeable changes is in how your urine looks, smells, or how often you pass it. A healthy person typically urinates 4 to 8 times a day, and the color usually ranges from pale yellow to light amber. But if your kidneys are struggling, you might notice dark, foamy, cloudy, or unusually light urine. Each of these changes carries meaning. For example, Dark urine could signal dehydration or waste buildup, while foamy or bubbly urine can indicate the presence of protein, a clear sign of early kidney damage called proteinuria. Some people notice they're urinating more frequently at night, a condition known as nocturia. This happens because weakened kidneys can't concentrate urine effectively, causing your body to release more fluid overnight. Others may notice the opposite, producing less urine than normal, which indicates reduced kidney filtration. Either extreme is concerning and should not be ignored. You might also notice a stronger odor or burning sensation. While infections can cause similar issues, persistent changes without infection can point to impaired kidney function or electrolyte imbalance. The kidneys manage sodium, potassium, and phosphorus balance in the body. When they struggle, the urine's concentration and acidity begin to shift. Foam in urine deserves special attention. It forms when protein leaks into urine, something that healthy kidneys normally prevent. Continuous frothiness, especially if it takes time to settle, means your kidney's tiny filters called nephrons are damaged and allowing important nutrients to escape. Over time, this can lead to swelling, fatigue, and further kidney decline if untreated. In the early stages, these changes may appear mild or occasional, perhaps a darker color after skipping water for a few hours, or slightly frothy urine after a heavy meal. But if such changes become frequent, last several days, or come with swelling or fatigue, it's time to take them seriously. Your kidneys may be struggling silently, long before blood tests show abnormal results. The good news: regular monitoring of your urine can help you detect issues early. Keep an eye on color, foam, and frequency. Drink enough water to stay hydrated, but avoid overhydration, especially if you already have kidney concerns. Hydration helps your kidneys flush out toxins gently, keeping waste moving through the system rather than allowing it to linger in your bloodstream. Diet plays a big role here as well. Reduce excess protein from red meat, limit processed salt, and increase natural plant-based foods like cucumbers, melons, and apples, which help maintain urinary balance. Herbal teas like barley water, nettle tea, and parsley water can also support gentle cleansing without straining your kidneys. Lastly, remember that urine is one of your body's simplest diagnostic tools, and it's free. Don't ignore small changes. If you see consistent darkening, foaminess, or frequency shifts, speak with your doctor about checking your creatinine, BUN, and GFR levels. Catching these signs early could mean the difference between prevention and permanent kidney damage. The fourth sign your kidneys may be under silent stress is unexplained itching or dryness of the skin. At first glance, it may seem unrelated. What do your kidneys have to do with your skin? Quite a lot, actually. Your kidneys are your body's internal cleansing system, filtering toxins and balancing minerals like calcium, phosphorus, and potassium. When they start to fail, these waste products begin to build up in your bloodstream, and one of the first places that imbalance shows is on your skin. Persistent itching, even without visible rashes, is often an early sign that your kidneys are struggling to maintain proper filtration. This kind of itch feels different. It's not caused by dryness from cold weather or allergies. It can be deeper, a constant, irritating sensation that spreads across your back, arms, legs, or scalp. Some people describe it as a crawling feeling under the skin or a burning itch that doesn't go away even after applying lotion. That's because the problem isn't on the surface. It's inside your blood. The buildup of urea, phosphorus, and other waste compounds irritates nerve endings in the skin. When kidney function declines, the body's balance of phosphorus and calcium is disrupted. High phosphorus levels can pull calcium out of your bones and deposit it in your skin and tissues, causing inflammation and severe itchiness. This is known as uremic pruritus, a common symptom in chronic kidney disease (CKD) that many people ignore until it worsens. Over time, scratching may cause redness, scarring, or even infection, but treating the skin alone doesn't solve the root cause. Another important clue is dryness that doesn't respond to normal skincare. Even after moisturizing, the skin may feel tight, flaky, or rough. This happens because kidney disease reduces sweat and oil gland activity, leading to reduced moisture in the skin. In some people, This dryness appears alongside changes in skin tone becoming pale, yellowish, or dull due to anemia and toxin accumulation. You might also notice itching is worse at night or after bathing in hot water. Warm water increases blood flow, which can bring more waste compounds to the skin's surface, intensifying the irritation. Avoiding very hot showers, using mild, fragrance-free soaps, and applying a gentle moisturizer immediately afterward can help reduce discomfort temporarily. However, the true healing comes from within. To address kidney-related skin issues, the main goal is to lower waste buildup in the bloodstream. Staying hydrated, controlling phosphorus through diet, and avoiding processed or salty foods can help. Foods rich in antioxidants like berries, apples, and red bell peppers help neutralize toxins naturally. Medical supervision is essential because your doctor may recommend phosphate binders or other treatments to restore mineral balance. Some natural kidney-supporting herbs like dandelion root and nettles may also support detoxification, but they should only be used under professional guidance. Avoid over-the-counter creams or strong steroids for itching without medical advice, as they can sometimes worsen underlying kidney problems. What's truly important to remember is that the skin acts as a mirror for what's happening inside your body. When the kidneys fail to cleanse properly, your skin tries to take over that job, leading to irritation and inflammation. So, if you've been experiencing persistent itching or unexplained dryness that no cream seems to fix, it's worth getting your kidney function checked. Kidney-related itching is not just a skin issue, it's a signal of imbalance deep within your body's filtration system. The earlier you listen to that signal, the easier it becomes to prevent further damage and restore balance naturally. By paying attention to these subtle cues, you're not only protecting your skin, you're protecting your kidneys, your energy, and your long-term health. The fifth and often most alarming early sign of kidney failure is shortness of breath or chest discomfort, a symptom that many people mistake for heart or lung issues. Your kidneys and lungs are closely connected in how they manage oxygen and fluid balance. When kidney function begins to decline, your body can no longer properly remove excess fluid. That fluid can slowly start building up not just in your legs or feet, but also in your lungs. This condition, known as pulmonary edema, makes it harder to breathe deeply or comfortably. You may notice that you feel short of breath even while resting, talking, or lying flat. This symptom often starts subtly. You might notice that you can't take long walks without getting winded, or that climbing stairs leaves you unusually breathless. Some people even wake up in the middle of the night gasping for air or needing to sit upright to catch their breath. This isn't just fatigue, it's a red flag that your body is retaining fluid where it shouldn't, and your kidneys are struggling to filter it out. In addition to fluid buildup, anemia caused by kidney disease can also lead to breathlessness. When your kidneys fail to produce enough of the hormone erythropoietin EPO, your red blood cell count drops. With fewer red blood cells to carry oxygen, your tissues, including your heart and lungs, receive less oxygen, forcing your body to work harder to breathe. That's why kidney patients often experience both shortness of breath and general weakness together. Sometimes, this shortness of breath comes with chest discomfort or tightness. The heart and kidneys share an intimate relationship. When one is under stress, the other feels it. High blood pressure, fluid overload, or toxin accumulation can make your heart pump harder, leading to heaviness or pressure in the chest. In advanced cases, this may also trigger irregular heartbeats or palpitations, which should never be ignored. Shortness of breath can also indicate acid buildup in the body, a condition called metabolic acidosis. When kidneys fail to regulate the body's acid-base balance, the blood becomes more acidic, affecting the lungs and muscles involved in breathing. As a result, breathing may become faster or more labored as your body tries to correct the imbalance by expelling extra carbon dioxide. If you ever notice that simple activities like walking, eating, or lying down make you feel breathless, don't wait for it to pass. Schedule a medical evaluation right away. Doctors may recommend blood tests, chest x-rays, or echocardiograms to determine whether the cause is fluid overload, anemia, or heart strain. Identifying the problem early can prevent more serious complications like heart failure or advanced kidney disease. In the meantime, small lifestyle adjustments can help reduce this symptom. Limit salt intake to prevent fluid retention, avoid processed foods, and stay hydrated in controlled amounts as advised by your doctor. Gentle breathing exercises, meditation, and yoga can help improve oxygen flow, ease stress, and support heart-kidney harmony naturally. Remember, shortness of breath isn't just a respiratory issue, it's a systemic warning sign that your organs are communicating distress. Ignoring it can allow both heart and kidney damage to progress silently. But paying attention, testing early, and making small corrections can help you restore balance, energy, and confidence in your health. Your breath is life's most basic rhythm. When it changes, listen closely. Sometimes, that breathless moment is your body's quiet cry for help, urging you to take action and protect your kidneys before it's too late. Now, let's take a moment to recap what we've learned today. The 5 early signs of kidney failure you should never ignore. Each of these signs is your body's quiet way of asking for help. They might seem small at first, but together, they tell a bigger story about how your kidneys are functioning. Ignoring these early warnings can lead to silent damage, but recognizing them early can save your kidney function and protect your overall health for years to come. Prevention always begins with awareness. Keep your blood pressure under control, reduce salt and processed food, stay hydrated, mindfully, and eat more natural, kidney-friendly foods like apples, cucumbers, and leafy greens. Regular blood and urine tests, especially for creatinine and GFR, can help you catch issues long before they become serious. Small lifestyle corrections made early can truly prevent kidney decline later in life. Your kidneys don't ask for much, just clean fuel, hydration, and care. Listen to them when they whisper, so they never have to shout. Healing begins not with fear, but with understanding and consistency. And that's exactly what this channel is here to help you with every week. If you're finding this information valuable so far, type healing in the comments below. Your comment doesn't just show support, it spreads awareness. You never know who might be watching this video today, silently dealing with the same symptoms. Together, let's build a community where we learn, heal, and protect our kidneys naturally. Thank you for watching Kidney Health. Stay consistent, stay calm, and take care of your kidneys. Because when they're healthy, every part of your body thrives.